Thyroid cancer. Everything you need to know. The thyroid gland, or thyroid, is an endocrine gland located in the frontal region of the neck, right below the Adam's apple in males. It produces three hormones that affect protein synthesis, heart rate, blood pressure, temperature, weight, and metabolic rate in the body. It also has an effect on children's growth and development. Thyroid cancer, as the name implies, is a cancer that affects the thyroid gland's tissues. Cells grow abnormally and spread to other places of the body, as they do with other types of cancer. The thyroid gland swells and a lump forms in the neck. Factors that cause the problem and those that put you at risk. As of today, the cause of thyroid cancer is unknown. Scientists, on the other hand, have formed certain assumptions about its cause and risk factors. These are some of them. Gender. Females are more vulnerable than males in general. Females in their 40s and 50s, as well as men in their 60s and 70s, are at a higher risk of developing the disease. Radiation exposure. The sickness can be brought on by a large amount of natural or artificial radiation. One example is head and neck radiation therapy, which is used to treat lymphoma. Hereditary or genetic issues. Having a genetic predisposition to the disease raises the likelihood of future generations contracting it. Multiple endocrine neoplasia type 2 can cause genetic issues. Cowden disease and familial adenomatous polyposis are two other complications. Other thyroid disorders. Previous thyroid disorders, such as thyroiditis, can raise the risk. Iodine deficiency. Iodine is required for the body to produce thyroid hormones. Iodine deficiency can make you more susceptible to getting cancer. Thyroid cells proliferate and reproduce fast, losing their ability to die. These massive quantities of cells clump together to form a tumor. They can also spread and infiltrate adjacent tissues and other sections of the body. Symptoms. Thyroid cancer is marked by enlarged lymph nodes in the neck. As the condition progresses, acute discomfort in the front region of the neck may occur, followed by a change in voice due to involvement of the larynx's recurrent nerve. Hyperthyroidism, hypothyroidism, and difficulty swallowing are some of the other symptoms. Thyroid cancer types. Researchers have divided thyroid cancer into the following kinds based on the nature of the cells in the thyroid tumor. Papillary cancer is the most frequent type of thyroid cancer, affecting adults between the ages of 30 and 50. The tumor is made up of follicular cells. It is classified as differentiated thyroid carcinoma and is linked to radiation exposure. Follicular cancer. This is a form of differentiated thyroid cancer that affects persons over the age of 50. It comes from the follicular cells of the thyroid gland. It's less common than papillary thyroid cancer and has little to do with radiation. Anaplastic thyroid cancer is an uncommon kind of thyroid cancer that mostly affects adults over the age of 60. It is difficult to cure since it arises from follicular cells. Cancer of the medulla. It comes from the C cells of the thyroid. An raised calcitonin level in the blood can signal the existence of this disease in its early stages. Precaution and prophylaxis. Because there is no known cure, prevention is the most important factor. As a result, the precautions are as follows. Those with a genetic predisposition to the condition have their thyroid surgically removed to prevent malignancy. Workers at nuclear power plants are exposed to high quantities of radiation, thus they need wear protective clothing. Iodine intake in the daily diet for people of all ages. Surgery to remove the thyroid gland is used to treat thyroid cancer, thyroidectomy. Chemotherapy, radioactive iodine ablation, RI, and other treatments are available. Thank you for watching. Please like, share, comment and subscribe for more contents like this.